And let's meet in downward facing dog. So before we actually go there, let me just clarify a few things. Move your knees back so you have a long stance, and see if you can get the pelvis. This is called anterior tilt. So when you lower the pubic bone, which is at the front of the pelvis, down and move it between your thighs, this action here, you see my lumbar, my low back forms an arch, the tailbone lifts. This is called anterior tilt of the pelvis. We're gonna try to keep that anterior tilt as you lift the knees up. Now what happens, see, I can see, I have a monitor, so it's easy for me to see if I'm doing it or not, but for most of you, if you don't have a camera on you, then what happens, and you can film yourself later, is when you lift your knees up, your buttocks engages, which is a good thing, but then it usually takes over and the tailbone starts to tuck and the hamstrings take over and the pelvis goes into this position here. You're gonna try to keep that tilt as you lift the hips up. Now, of course, keeping the knees bent at first is gonna make that more accessible because it doesn't put the tension on the hamstrings. But as you start to straighten the legs, your tailbone will naturally tuck because of the tension on the hamstrings. We like that tension on the hamstrings. We're not trying to lose it. We just want to also engage the low back muscles. So lift your sit bones up and that will stretch. So if you stick your butt up and move your pubic bone between your thighs, so lift your sit bones, that's your buttock bones, lift your butt up and move your pubic bone between your thighs, then you'll feel a stretch in the hamstrings from the strength of your low back, which is different than dropping your chest down. All right? I didn't say press your chest back. We're trying to lift the sit bones up, pubic bone between the thighs. That's going to be a stretch for the hamstrings, more anterior tilt as it's called. Open up warrior two. Okay, so what just happened from lunge to warrior two is we rotated the pelvis around the right femur bone. So pelvis moved around the right leg, okay? So a lot of people get all worked up when you start moving the pelvis around the standing femur bone because it's bearing weight and they think, oh, this is gonna destroy the hip. We do it all the time from a pose like lunge to warrior two. You know, for example, if you move the pelvis from warrior three to Ardha Chandrasana, that's the same movement. So there's not much of a difference there, maybe more weight slightly, but it's something that we should be able to do naturally. Now, if you feel pain in the hip when you do that, there's a couple things you want to assess, and that's what's moving, what's driving the movement, and where your balance is, where your weight is shifting, and all of. There's a lot of things you can address, and we'll work on all of them as we go. But more often than not, it's just a lack of strengthening in the muscles that surround the hip, and if you strengthen those muscles, the hip is going to feel a lot better, and you'll feel less pressure. So what you want to do is transitioning from here to here is push down through your right heel. So try it with me from lunge. Push down through your right heel so you feel your right glutes engaged. Your hips will lift as a result. And transition by rotating the pelvis, not the back leg. Rotate the pelvis. The back leg will go with the pelvis. Now, a lot of times in warrior two, what people do is they press the pelvis forward. That puts like a pressure on the front of the hip joints. The thigh bones are pressing towards the anterior side. That's the front side of the hips. And the ligaments are having to hold on. So what we want to do is actually, we don't want to strain the ligaments. We're not trying to, press the thigh bones and kind of challenge the joint. We want to move the thigh bones back into a space where there's a lot more range of motion, right? The most amount of range of motion is when you're on all fours. That's the most congruent, as it's called. So we want to move our hips back towards as if we were on all fours, where the thigh bones are not coming, putting pressure this way to the front, but we get a little bit of suction back. So think about moving back as if you're going to sit in a chair. So pelvis goes back slightly. As the pelvis goes back slightly, you'll feel a little more space in the joints. Okay, but what you might notice is your right knee comes in, and that's because the right inner thighs are a little tight and the right buttocks is perhaps a little bit weak. So press your right center or outer of your outer heel down and see if you can get your right glutes to turn on. Now we don't have to, jack the knee out to the right, but you want to slowly start to rotate the thigh bone out to the right. And it doesn't have to line up over the center of the heel or over the pinky toe or something like this, but you want to be moving in the direction of rotating the right thigh bone out. So I'm exhausted just keeping the thigh bones back and trying to externally rotate this front thigh out to the right. I feel it in my right hip. Hopefully you're starting to feel that too, getting pretty tired. Exhale, hands to the ground. Now here, turn the pelvis slowly towards the ground. We're going to straighten through the right leg. Again, lengthen the chest. Exhale and bow. Why not dorsiflex the foot? Now I'm going to show you if we just rotate the pelvis a little bit, it's going to change the stretch. So turn your left pelvis down towards the ground and towards your right thigh. So you see I can tell you it's easier if you think about the left foot. Turn your left foot towards the, in my case, the wall here, towards the right side of the mat. But what I'm doing is the pelvis is rotating around the right thigh bone, and you're gonna feel by turning the pelvis inward, the right outer buttocks and hips stretch more. You can feel that, right? In the outer right buttocks, the right sit bones, the IT band, the outside of your leg stretches more. So the rotation of your pelvis is going to shift what muscles are stretching.